chef's kiss.
Can't do my job.
Maybe don't get your lips done by them.
Lips are humbling.
I've had lip filler and gone straight to dinner before this, so.
Your injector will know what to do. Should know what to do.
The Russian lip is a wild trend.
Ew, it looks bad. Why would you want it?
Welcome to Fill and Tell, where we spill the tea on all things aesthetics.
We're your hosts. I'm Megan.
And I'm Lauren.
We're here to give you the inside scoop on what goes on behind the treatment room door.
From filler to facelifts, skincare to aesthetic secrets.
We're taking you behind the scenes of the industry with unfiltered conversations, expert insights, and maybe a little gossip along the way.
The hottest, most talked about procedure in aesthetics, lip filler. The gateway to all of aesthetics, I think.
It really is the gateway drug. Either Botox or lip filler.
Yeah, they kind of go hand in hand. And so we're going to talk about the good, the bad, the ugly,
There's a lot
the
of
illegal.
Ugly and illegal will be all over your TikTok feed.
And so I think that lip filler is mostly accepted by a lot of patients. It's definitely the thing that people are asking for the most, but then there is a subset of patients who are terrified of lip filler, who, you know, are worried about how it's going to look and things like that. So we're just going to go over all of it and what we love, techniques, products, what we used to do, what we don't do anymore. And so
fun
it's
fact.
Be a fun topic.
Yeah. Fun fact, I have never had lip filler.
True.
Lauren has had lip filler, and then we dissolved it
a
few months ago and refilled.
Yeah. Was it a few? It was like, I feel like it was
maybe it was like April.
6 months ago or so.
Yeah.
And we've dissolved it once? I don't remember.
I think it was just one time.
Yeah. I had it back in 2022.
Something like that. And we put very little amounts.
But then I think it might have been product choice is what we ended up needing to dissolve mine for, because it wasn't really technique. I didn't have any bumps or anything, but I think it was the product choice that we were using. And it's not like we put
a whole, I don't even think you had a full syringe in there.
But I was getting that little mustache and that little ledge above my lip, and so we dissolved it all, which is a hilarious video because I didn't let Megan numb me, and I was like, just get it over with. That was a terrible mistake.
Well, we have this like blowtorch of cold air. I always forget the name. Zimmer.
Subsea.
Yeah. And so Lauren decided that instead of getting a little bit of topical numbing or a dental block to ease all of her pain, she would do this blowtorch of cold air on her lips. She probably has a photo we'll put up there. She got so swollen.
So bruised.
I'm like, and then I'm trying to inject this Hylenex, and she's like, ow, ow, ow. I'm like, oh my gosh, I can't do my job because you're in pain.
Yeah, so I wouldn't recommend that to patients, obviously, because it does hurt a little bit to have them dissolved. But lip filler doesn't have to be ducky. It doesn't have to be big. It doesn't have to look bad. It doesn't have to be what you see on the internet. It can be very natural and seamless and beautiful. And like, it is the cherry on top of everyone's facial treatment plan. It's always the thing I put on there last, but it truly does just round everything out. And it's like, chef's kiss.
Because usually it's just an accessory. Like usually they need a little bit of cheek support, a little bit of chin, but the final icing on top, the cherry on top, it really does. It brings everything together. I feel like that's why I'm noticing or maybe wanting lip filler a little bit more is just I'm like happy with the injections that I've gotten. We've never gone overboard. And now I'm just feeling like maybe
that last little bit. And it truly will change. Like, I look back at some of the earlier podcast episodes we did when I was kind of like in between refilling and dissolving, and it looks a lot better, I think, now.
Yeah, I agree. It can be anything from some subtle hydration.
True.
To
truly volume.
Yeah.
To true volume.
Like my assistant Maddie, she loves the bigger lips, which I think so the trend, like in like 2010-ish, you know, around this time when lip filler got FDA approved, everyone, especially Kylie Jenner, was like that movement where people wanted big lips to the point of, you know, as practitioners, we have this do no harm, and you were getting into like, it was harmful because it's stretching your lip tissue when it gets that big. And then if you're going into like unnatural procedures, which is the
like
silicone,
and implants.
Implants, that's what I was trying to think. Then that gets crazy. So anyways, like the point I was trying to make is that
historically, we've had some bad lips
Yeah.
done, essentially. When Juvederm hit the market back, whatever, in the 2000s, I don't even know what it was indicated for when it first came out. It was probably indicated for folds.
It was. I think Juvederm Ultra Plus was the folds.
Okay.
And then it got like 2010 got approved for lips.
Okay.
Restylane was a little bit earlier than that, but.
And so I must have been the way people were injecting. They were probably shoving the whole syringe in there all at one time, wasn't really paying attention to what this person's lips look like, the anatomy of them. And so we had this huge wave of really bad looking lips.
Well, and I wanted to point something out because you just made a good point. You were like, people were just shoving a whole syringe into their patient's lips. And I think how we've gotten away from that is by charging just a flat fee. We like to do this because patients will say, well, what are you going to do? I've paid for the full syringe.
Yeah.
So I want the full syringe. And I think a great way to get around that is like, you don't need the full syringe, and you can either put it somewhere else, or like lips are such a technique that like this is the charge for lips, and we'll go from there.
Yeah, we will do what's best for your lip tissue, and if we have to do a second session, like of course I keep that in mind when it comes to price, especially with somebody who has small lips or we're really trying to build something. But of course, like it isn't a half or a full.
Yeah. No.
Some people do it that way, which is totally fine. I'm not against it, but it's just, this makes it easier. I can control what products I'm using, how much I'm using, and we really just go according to what your goals are and what your tissue can hold at that time.
And fun fact, we typically do 2 different profiles, 2 different rheologies, because we need,
at least.
Yeah, we need some hydration, and then we need a little bit of structure. And so that, the way we like to do it ensures that we can give you the best lip while not having to just use one syringe of something.
And so I think, there's a lot of celebrities out there who have had some bad work done, and thankfully a lot of them have actually realized it and undone it. Jessica Simpson was one. There was a picture of her. She went away for a little while and then kind of like resurfaced, and there was this massive lip photo of her, and we'll send it and put it up here. But then she dissolved them and they looked so good. Heidi Montag went through like that whole, did you watch The Hills?
Yes.
Yeah. So when she had her whole big transformation of sitting down with her mom, and she can barely move her face, she can't even cry.
Yes.
And she still is kind of, I think, a little bit out there. Yeah. Kylie Jenner is one.
But she has really reversed. And she even said she regretted some of her plastic surgery.
Avery Woods just dissolved her lips.
Yep.
And
I think Alex Earl too has. Yeah, and she's gone a little bit smaller. She even like had a TikTok that was like, "Friends, why didn't you tell me my lips look like that?" Or like, "I had so much migration."
That's a hard conversation to have. Either you can't recognize it, right? You can't really see it. Your friends can't really see it. But it's also just like a hard conversation to bring up with somebody, to be like, yo.
Well, and I've had
your
patients
lips look bad.
I've had patients that are like, I would rather have migration because I'm so scared of what my lips will look like smaller. And I'm like, nah, just do it and we'll refill them. Because right now, you're walking into a room and your lips are walking in first. Because they're migrated, they're too big. No, so I hate that for the people that are curious about filler, who do have an open mind, but then you see, Karen walk past you who's just so overdone.
Right.
Because it really does ruin it for the people who are curious, but also you just you only see the bad work.
Yeah.
You only
and
see
that's
the bad
why
work.
we're making it our mission now to show all the good stuff.
Yeah.
And
well, okay, this isn't planned, but why don't we really quick talk about the filler we've had done? Really quick.
Okay. Temple filler, cheek filler, lip filler, chin filler, jawline filler.
Yep.
Sculptra.
And Botox.
And Botox.
Okay.
I think.
Yeah, I mean, Lauren is beautiful and looks very natural, and everyone
probably
wants to know
like
what she's done.
9 syringes?
Over the course of 4 years, guys. Yeah. Like, this isn't like we didn't shove all this filler in her face all at once. I've had cheek filler twice, chin filler twice, a little bit of jawline. I get full face Botox, masseters especially.
Yeah.
Piriform I've had done. A little bit, we've done some Skin Vive. In my nasolabial folds, we've done Skin Vive for hydration on my skin.
Same. Yeah, I forgot about that.
I have not had lip filler. I think that's
the next on the list.
It is. I'm ready.
And a big question that I get all the time is, how can all of these celebrities who look bad, they can afford the best? Why do they look like that? What do you think?
I think it's multifactorial. I think that because of their status, they go in and they say, I want this, this, and this. And whether the doctor doesn't want to say no, because then he wouldn't have them as their patient, or, I think that's it. They don't want to say no. But then also...
And then I think too, like, we've seen it happen. Influencers get discounts for things, right? To promote your space, to promote this Injector, to promote this new place that just opened. And you're getting this discount, you're getting it for free. And so you're just coming in and you're getting it done. And I think that is really where some things kind of just got out of hand. It was like, I'm going to offer you this free stuff, just come in and get it and then post about it.
Yep.
So.
Or the opposite of free, that practitioner wants to make money. So they say yes, they say yes, they say yes.
The greedy, the grabs.
Well, and even if you're not greedy, like when we were in the beginning of our careers, it is hard to say no to somebody. It is hard to have that hard conversation. It is hard to say, hey, look at this photo, like you have this filler mustache here. It actually is hard no matter who you are. I think it gets a little bit easier because you find ways to talk to patients and ways to tone it down and like ease into it. But I could see a young provider charging less, one, so that patient gets a discount versus the other med spa down the road. And two, they have a hard time saying no.
Yeah. So let's talk a little bit about like what makes up the lip, because the lip is complex, I think,
I agree.
and it's a really complicated and complex area to treat. When it's done right, it's done fantastic, but when it's done wrong, it looks bad. And so everyone's lips are different, but the primary areas of the lips, you have the vermilion border, which is that kind of crispy edge. You have the Cupid's bow. Some people's are defined, some people's are not. We all have different lip tissue, so...
I mean, you can even go look at a photo of Lauren and I. I don't really have a defined Cupid's bow.
Yeah, I just noticed that.
And Lauren does. So, again, this is based on your anatomy. I wouldn't expect her to build me a crisp Cupid's bow. I think that is where you could easily get into migration and unnatural look.
Yeah, it's hard to make somebody who's round two perfect like little triangles.
You have to respect anatomy.
Correct. And then you have different types of lip tissue. So like when you look at someone's lips, is it loose? Is it tight? Like, and that really directs your product choice. And so it's funny because some people feel the vermilion border, some people don't. I like to do it on my more mature patients who you can really see they have nothing there.
Yeah.
Like you still have a vermilion border that is juicy. And the vermilion border is the outline of your lips. So you kind of think of it like a tire. It's like it's got air in the tire, and as you mature, like that air just kind of deflates.
Does. And that's why you get those lip lines.
You get lip lines. You start to have lipstick that's bleeding. So in those patients, you should, I think, fill the vermilion border. In patients like us, you don't necessarily need to do that.
Another area, and I know you love this area too, is the oral commissure.
Yes.
You start to see a downturn, and that's from, again, multifactorial, but losing that collagen, elastin, and HA in your lips as you age. As they get thinner, this turns down. You can also put Botox here, but I love filling that area. A good injector will look at the perioral area as a whole.
As a whole, yeah. So kind of like from the edge of your nose all the way down. Lip framing, lip support.
There's been several patients that think, well, they want lip filler, but as your provider, do no wrong, do no harm. It would be against, what am I thinking? Against like our nature to enhance your lips if your chin is recessed. You know, you really have to look at it as a whole. We ultimately like want what's best for you. We're not trying to have you get chin filler because it gives us more money in our pocket. It's never about that. It's about balancing your features. It's about being harmonious, and it is about
And there's a degree, okay? So, and I talk to patients about this a lot. There's a degree to which I will, on my young patient.
Of course.
I had one the other day who really does need some profile balancing. She's young, she's got good tissue. So, like, giving her lip is fine. And I'm not going to say no to her because that's what she desires. But then there will become a point where, okay, you have to say, okay, we've given you some lip, but in order to make that any bigger, you really need to have some support down there. And she, was understanding. But there is that fine line of...
I think it's about education,
correct.
Which I know you do a great job at.
But really where it comes unsafe is you have somebody come in who already is fully filled and they want more. You injecting them does put them at risk for, vascularity issues, at risk of migration. And so you're doing harm in the fact that you're putting them at risk for something that's not natural and normal for them.
Right.
And so just kind of keeping that in mind. Everyone's beauty standards are very different, but you still have to maintain your own integrity and not harming the patient in that way.
I think that's where we get these crazy outcomes too, is that you see Hailey Bieber's lips or, Lindsay Lohan's or Kylie Jenner's, and you want that. We have that a lot less now. I do think that there's a movement towards like less is more, natural filler, just subtle enhancements, which I love. But there are those every now and again where you just see a celebrity, even with like someone's hair. It's like, I've said this to my hairstylist. I've always said that I wanted my like blonde to look like Lauren and our friend Becca's. And Sarah's like, Megan, it never will. You have a different base color.
Yeah.
Unless you want me to completely bleach your hair. And I totally trust her and I love how she does my hair. But it just goes back to like, she's not going to put me at harm to get me this result that I think I want. So that's just a little analogy.
Everything.
Yeah.
So if you're thinking about getting lip filler, you want to really go have a consult with an injector, sit down, talk about what your goals are, like what are the realistic expectations, are you going to have one session or 2 sessions, and going over all the risk. I think that that's proper protocol for everyone. I think that it's a little bit of a red flag when you can just go online, book your lip filler appointment, you show up, you've never met this person before, and you do it and you move on with your life.
I agree.
You have to really, I love being able to establish a relationship with someone, talk about what their goals are, what's going on, what events do you have, are you ready to have some swelling or bruising, like do you understand all of the risks? Yes, great, perfect, let's make your appointment from there.
Yeah, we're big on consults.
And I think that checking before and after is like looking at somebody's lips. If they don't post any lip filler, maybe don't get your lips done by them.
Or if you love this injector but you don't like the lips that she puts out there, then maybe her aesthetic isn't for you.
Right. And I think that's totally fine and reasonable for patients to decide. And so then we can get into like techniques, and this is where really things have changed.
Especially for
us. When you first start doing lip filler, I don't even remember how I started doing lip filler. Probably just like horizontal
and
struts
with the actual syringe.
With the actual syringe.
We'd never do that anymore.
No.
It's just too bulky.
And so a syringe comes in, it's like this big.
Yeah.
Plus you have the plunger on the end. So you're working with something that's really long.
Yes.
You have not a lot of
needle
control.
is longer.
And I wasn't doing a lot of structure when I first started. I was more so just building volume. So a lot of just like horizontal struts. And now I think that it's very reverse. I like to build structure, then fill tissue, a lot of subcision, and then using smaller needles and backfilling needles for sure.
Yeah, because I think when you just do the horizontal struts, sometimes it can just give you that like outward appearance versus what Lauren's talking about, struts. They sort of, we poke from the top and come up. That can give you some volume.
Yeah.
A lot of people can have a little bit of height added on, volume, in the vertical way.
Right,
and then
decreasing this kind of distance here will make a more mature patient look a little bit younger and more youthful. And then technique-wise, some people use a cannula. It's not my preferred technique at all.
I think it's cool, and I would love to be better at it, but I don't feel like I have the control.
Or the precision.
Yeah.
But there are some people who do it beautifully.
They really do.
And I think that's a huge skill. And then the Russian lip is a wild trend.
Ew, it looks bad. Why would you want it?
It's like, it really
Why?
is mind-boggling to me when I look at, I've watched people do the videos.
Oh,
and
you
I
get
was
sucked
like,
in.
I'm like mesmerized because I'm like,
They put
how
so much filler in there.
so much.
Oh my gosh, and it's like
We'll put a picture up of a Russian lip,
Yeah.
and the technique in order to get it, I mean, they're taking this vertical strut down and literally keeping that needle in there and just building and like fanning and building and fanning, and they're flipping the lip back and using a very stiff product to get that lip to stay flipped up. I think that's going out, thank God. But the
I wonder
Russian
what
lip
product
is a
they're
weird-
using, because even when I use Define in the lip, I don't think I could
You
achieve
can't get
that.
Yeah. But there's so many different techniques.
Yeah.
Megan and I use a similar technique. Megan taught me a lot. She went to lip filler training. Thankfully, she went and she brought back a bunch of pearls for me.
I want to go again. I
know.
love Katrina and Lindsay out of Alon Aesthetics in Tampa.
Yes.
They're lip gurus. I forget why Lauren couldn't come. I know it was right around Thanksgiving, but I want us to go again.
Yeah, so she did that course and then came back and really taught me a ton. And so I was able to change my technique and get better outcomes.
And what I learned from there too was that it really is so dependent on product choice.
Yeah.
So that's where we started, doing a flat fee, and we've been able to pick and choose the product for your lip,
Right.
Not just like a one size fits all, because it's really not. And I think that's where our lips have really transformed.
Yes, and going more superficial,
Yes.
not really staying out of the muscle of the lip, because that's how you can get some migration as well, and putting that product more superficial. I think I'm surprised at how well it integrates, still very superficial.
Yeah.
And again, picking the right product so that you're not left with
Bumps
and just like, thick. I've had that happen, and thankfully this patient was like
Chill.
very trusting, and I was like, look, this is not the right product for your lips.
I remember that.
Let's take it out, give you a couple of weeks, and let's regroup. And she was like, okay. So
Yeah, and sometimes you can think you're picking the right product, but then when you push it, it just doesn't integrate well. And I think that says so much about you actually as a practitioner versus being like, oh, you're fine.
It's gonna be
it looks
fine.
good. I love that you were really vulnerable and you were like, hey, I just don't think this looks as good as it could.
Yeah.
Do you mind if we
just take
start
it out.
over?
I know.
So-
And that sucks, but it is way better for the patient to do that.
Yes.
I am, and you do have to humble yourself for a second. And and I've done that to somebody else, I'm like, that doesn't look good. We need to take it out. Even though I put it in there. And so, but it happens. And so I think that that's those humble moments but you don't want people walking around like that.
Yeah.
So,
But to be
ego
honest,
aside.
like lip filler, lips are humbling.
Oh,
like
for
people,
sure.
it's always wild to me that they've never had filler before, and they are just like ready to jump into lip filler because there's such a technique behind it. I think
yeah.
besides like forehead Botox, it is one of the most challenging
For sure.
areas of filler. Okay, so Lauren, if I'm your patient, like what can I expect at a lip filler appointment?
You're going to come in. Hopefully you don't have a ton of makeup on. I really like to make sure the area like surrounding the lip, not just the lip, is clean because you're touching a lot of area. So I'll have you wash your face. I like to do a dental block. It's quicker. It's very comfortable for patients. So they come in, they have their photos taken, they take their makeup off. We're doing a dental block. We're pulling the product. My assistant is helping to backfill this product. We get into the room. I take some more photos. Procedure takes about 20-30 minutes, depending on the complexity of it. And then I always tell them expect 15 to 20% more volume and swelling right when you see it then. It's going to go down about that much over the next few days.
We also are going to put up a picture of the vascularity of the lips, and you'll understand why when you ask us, will I bruise?
So much.
I mean, we can't tell. I mean, we aren't future tellers, but also probably.
Yeah,
So
at least a little bit.
Be careful, be ready for some swelling. Mm-hmm. It'll go down, and be ready for some bruising.
And I think product choice really dictates swelling.
Agreed.
We don't have a ton of swelling. Like, you're swollen, yes, because we just poked you 100 times with a needle, so that tissue swells. But we see way less day after swelling because of the products that we're using. They're just not so hydrophilic. and they're not swelling and pulling in tons and tons of water. And I really like that.
Me too.
About the product choices, because a lot of swelling can cause a little bit of migration, I think, if you have too much.
I agree. And that's why we've kind of gone away from some products and started focusing and doing lips with other products.
Right.
I wanted to mention something with the dental block. I didn't realize how many patients are so scared of a dental block.
They're literally does not hurt at all, though.
They as soon as I'm like, yeah, we're not going to do the topical anymore. This will be much better for you. I promise. They're like, oh my gosh, a dental block. I'm like, it's so easy.
So comfortable.
And then when we do it, they're totally like, oh, that was so easy.
They can literally fall asleep.
Yes. They feel like they're drooling.
Because you can't feel anything.
But I wanted to say that you'll be numb for a few hours after. And so just take note of that. And if you have dinner plans and it's with, your in-laws and maybe you don't want them to know you got lip filler, probably don't want to do it.
I've had lip filler and gone straight to dinner before this. So
we've also done your sculpture and you've gone straight to dinner. Okay. So
then what are you telling your patients risk-wise, safety-wise? Like, what are you cautioning them at their consult?
Yeah. Besides what we just talked about with swelling, bruising,
swelling, obviously.
Those are more just adverse events. Those are going to happen.
Right.
A true risk, the biggest one, but also the most rare, is a vascular occlusion.
Right.
And that's when the filler gets into a blood vessel. What happens then is it blocks blood flow. And so if you don't catch it in enough time, or you don't have the resources, or if it's a really bad blockage, then you could potentially get necrosis. Your injector will know what to do. Should know what to do. And that's why it's very important to vet out your injectors.
Yeah. And typically again, these are rare things. They don't happen as much as the internet portrays them to. I think that biggest thing is just checking capillary refill, making sure that bruise is not a problem. Usually, because you can get a gnarly hematoma and a big bruise if you hit a big vessel.
And I feel like the difference between a vascular occlusion and a bruise is that typically with that vascular occlusion, since you are blocking the blood flow, which is oxygen to the skin, the patient is going to notice they're going to have some pain, which has been different the whole procedure, right? Because they've been so numb. And then the other thing we both like to do is if you have a history of cold sores, let's pre-treat you and get you on something. So
doing a little bit of valcyclovir, Valtrex beforehand will just prevent something from popping up, and then really avoid dental work. I have my patients not have any dental work done 2 weeks before, 2 weeks after, no vaccines. You just don't want anything that's going to
inflammatory.
Yeah, and cause an inflammatory cascade there.
Okay. So there's not a lot of new fillers out there for filler or anything like that, but something new that we've been exploring is PDGF in the lips to more so just help with collagen. When you're looking at your lips in the mirror, seeing those lines in the lips and that dehydration is a sign of volume loss. And so really your filler candidate once you start to have that. But using PDGF, using some regenerative treatments can help to rebuild that tissue potentially. And even bringing your microneedling across your vermilion, bringing your cool peel across your lip, your BBL.
Hydrofacial even has a lip option where you can do it's called a lip perk. And so it kind of stimulates some blood flow and can plump your lips. Doing a cool peel over your lips is a natural collagen stimulator. So just thinking about these things, if you're just not ready for lip filler, you can add on these services to enhance your natural lip shape and look.
Absolutely. And then there is a lip product that Lauren has got me onto that I think enhances even the best lip filler, even if your lip, I love Lauren's lips. We've done lip filler on her, like we said, but whenever we put on this gloss, it just enhances them so much. It has a few peptides in it, right?
It's called On Gloss. We're going to do a little plug. You can get On Gloss on Dewstate.com. And so we're going to do product highlights, like the pod product highlight of the week.
I love that.
Whatever it is.
What a great name.
I know. And it comes in a classic color, berry. And it's so
They sent you
pretty.
Yes.
I'm on their PR list.
I love that.
Me too.
I'm jealous.
And so they have beautiful colors. It has 5 skin identical ceramides in it, and then 2 plumping products in there as well. So you're getting a lot of lip conditioning, some lip plumping. It has this really nice, cool tip.
I love that part.
And I feel like the product lasts for a while.
Yeah, I agree.
It lasts for a really long time. They came out with Berry Crumble last year, and I had the lab sample.
Oh, you mean? Oh, I was like, it lasts a long time on my
the
actual lips,
but also
too.
just like in general. And
Yeah.
I'm just now running out of it, and they just launched the new one and
Nice.
sent it to me. So you can get On Gloss at dewstate.com and add it to your, favorite lip liner, your favorite lip filler.
Yep. Yeah, whether you have lip filler or not, like myself, I really do feel like it helps to hydrate and condition, like you just said. So, if you have any questions about lip filler, if you want to know if you should dissolve, if you need to refill, if you're a candidate, please let us know. Ask us in the DMs.
Yeah.
Lip filler is one of our favorite topics, so don't be shy. Ask any question.
Yes, and don't be scared. I think that's a big thing. Don't be scared. Just trust your injector. Make sure you're very clear on your goals, and you're going to have a really great outcome that you love for a long time.
Yes.
So,
all right.
till next time.